Welcome to this educational program. This module provides a general introduction to premature ejaculation, or PE. This information is taken from a recent review of the medical literature and attempts to be as comprehensive as possible. However, it may not necessarily reflect the experience of your healthcare provider or the specifics of your situation. This program is strictly informational in nature, and no attempt is made to provide opinion or recommendation. Please feel free to view this presentation as many times as necessary. You may also use the player on your left to repeat slides or to skip through them in any order you wish. Premature ejaculation, or PE, is a common sexual disorder, affecting as many as 1/3 of men to some degree. It is now understood that often PE does not have a psychological cause, rather a biologic one. Most importantly, premature ejaculation can be successfully treated. All of this will be discussed in detail through the rest of this presentation. Before going further, we must emphasize a few important points. Firstly, PE is an evolving field of study, and much is yet to be learned about how common it is, what causes it, and how best to treat it. Furthermore, current treatments have been developed through clinical practice and research by experts in the field and have employed medications that were developed for other health conditions. As such, the treatments described in this presentation are not necessarily approved for use in premature ejaculation by the U.S. Food and Drug Administration, Health Canada, or other regulatory bodies. Their use is based on clinical experience, research data, and consensus among expert clinicians in the field. As with any condition, treatments for PE should be individualized with your physician, and potential benefits must outweigh the potential risks. There are many different ways to define premature ejaculation. The American Urological Association defines it as ejaculation that occurs sooner than desired, either before or shortly after penetration, causing distress to either one or both partners. One of the challenges facing doctors treating this condition is that there has previously been very little agreement as to how to define it. The American Urological Association definition just quoted is based on medical history alone. In other words, the diagnosis is made after a careful interview with the patient and his partner. Others have tried to more precisely define premature ejaculation by measuring what is called the intravaginal ejaculatory latency time, or IELT, whereby the patient or partner uses a stopwatch to measure the time to ejaculation from the time of penetration. Based on several large studies around the world, it appears that the average time for most men is between 4 and 7 minutes. It has been proposed that the following conclusions can be drawn based on the measurement of IELT. If the time interval is less than 1 minute, then the patient has PE, and if it is 1 to 1.5 minutes, he probably has PE. It is worth noting that 6% of men report a more severe situation where they ejaculate during foreplay before being able to achieve penetration at all. Measuring vaginal penetration time to ejaculation in this manner is obviously cumbersome for a couple, and this method is most commonly used for research purposes only. In clinical practice, the diagnosis is usually made by simply questioning the couple. Many questionnaires have also been used to diagnose and assess PE, but again, these are mostly used for research purposes. There are many different so-called sexual disorders, such as erectile dysfunction, decreased sex drive or libido, and premature ejaculation. PE is likely the most common of these, although the exact number of men who experience it is not known for certain. Premature ejaculation can have several negative consequences in a man's sexual relationships. These men report having less frequent intercourse, along with anxiety about having intercourse. It is possible, however, that some men have anxiety due to infrequent intercourse that actually leads to the premature ejaculation. They also report less sexual satisfaction more commonly than other men. The condition can cause distress to the man's partner also, as they may feel rejected by the man who withdraws emotionally after an embarrassing sexual experience. This often is the reason for the man seeking help. Ultimately, these strains can lead to relationship problems for the affected couple. Having said this, it is important to point out that PE does not affect a man's sexual desire or reduce his ability to become aroused. The normal male sexual response begins with mental and physical arousal, which depends on the presence of a normal sex drive, or libido, which in turn requires normal levels of the male hormone testosterone. Erection is the process of blood rushing in to fill the erectile bodies of the penis and being trapped there to keep the penis firm. During orgasm or climax, sperm and semen fluid are first deposited and mixed in the urine channel or urethra in a process called emission. This then stimulates relaxation of the sphincter or valve muscle around the urethra and rhythmic contractions of the muscles around the urethra to propel the semen forward in the process of ejaculation. Following this, blood flows out of the penis and the erection goes away. This process is called detumescence. This normal sexual response is very detailed and involves a complex interaction involving hormones, different nervous systems, a variety of sexual organs, and specialized muscles. There are different theories about the cause of premature ejaculation. The old thinking was that PE was purely a psychological problem relating to early sexual experiences and conditioning, and anxiety related to sexual performance. More recently, doctors have learned that PE is mostly a biological and not a psychological problem. It is likely that in many men, there may be a genetic link to premature ejaculation, leading to a relative lack of or poor response to certain chemicals that transmit signals required to delay ejaculation. The chemical in the nervous system that has been pinpointed is called serotonin, or 5-HT. In almost half of the men with PE, there may be an important association with erectile dysfunction, or ED. In some, early ejaculation may be a separate issue, while in others, PE results from rushing intercourse because the erection does not last long, or from performance anxiety resulting from the erection problem. It may also relate to the prolonged stimulation required to achieve a full erection. As mentioned earlier, PE is diagnosed by a careful interview with your physician, with or without your partner present. Questions are asked about your general medical condition, as well as focused questions about your sexual function. Intravaginal latency time is usually only measured for research purposes. Premature ejaculation may be treated with one or more of the following: psychosexual counseling, behavioral therapy, anesthetic creams and gels, or medications taken by mouth. When ED is present, it is usually treated first. At this time, there is no role for surgery. Because PE is a lifestyle issue and does not otherwise affect a man's health or longevity, and because it is not something that is easily measured, the goal of treating the condition, regardless of what is chosen, is simply to achieve the satisfaction of both the patient and his partner. A psychological assessment and counseling may be appropriate for some patients. These will usually consist of a series of interviews with or without your partner, with a sexual therapist, psychologist, or psychiatrist. Questionnaires may also be used. Behavioral therapy, popularized by the famous team of Masters and Johnson, used to be the mainstay of treatment for premature ejaculation. Methods included the so-called stop-start maneuver and the squeeze technique. Behavioral therapy is expensive, time-consuming, and requires a willing partner. Many patients will not have access to a skilled therapist, and the long-term results can be disappointing. Creams and gels are available that contain anesthetic or freezing compounds that numb the skin of the penis to reduce its sensitivity. These substances are rubbed onto the penis 20 to 30 minutes prior to intercourse, then covered with a condom. The condom can be left on or removed prior to intercourse, and the penis wiped clean of any remaining compound. This treatment can work for some men and is prescribed by many doctors. These creams are usually found near the condoms in drugstores, or more commonly, already applied to the condom itself. Potential difficulties with this therapy can arise if the cream is left on too long, causing too much numbness, resulting in loss of erection or over-delayed ejaculation. Also, if a condom is not used, or if residual compound is not wiped away, it might end up being applied to one's partner, who might also lose sensitivity. Finally, these compounds can cause penile irritation in some men, and they can interfere with the spontaneity in a relationship. Medications taken by mouth, or pills, have become one of the primary treatments for premature ejaculation, and most commonly used are those in a class called serotonin reuptake inhibitors, or SRIs. In higher doses, these drugs have been widely used for treating depression, and delay of ejaculation was first noted as a common side effect. These drugs work to increase the level of the biological chemical serotonin in the nervous system, to delay the nerve signals that trigger ejaculation. Examples of drugs in this class include paroxetine, or Paxil, sertraline or Zoloft, fluoxetine or Prozac, and clomipramine or anafranil. As mentioned earlier, the use of these drugs for PE is considered off-label by the U.S. Food and Drug Administration, Health Canada, and other bodies, meaning that this was not a condition that these drugs were originally approved for. As much as 40% of drug use is off-label, and the benefits and safety of a particular drug for a particular use should be explained by your doctor. Paroxetine, or Paxil, is currently the most commonly used drug for PE. It is usually prescribed at a dose of 20 milligrams, and occasionally 40 milligrams, and it's taken either daily or before intercourse as described shortly. It will take 5 to 10 days of regular use to benefit fully from this medication. Possible side effects of paroxetine include, but are not limited to, nausea, dry mouth, complete lack of ejaculation, inhibited orgasm, and decreased sex drive. Paroxetine may also interact with several other medications. Consult with your doctor, pharmacist, or package insert for a complete list of side effects and drug interactions, and be sure your doctor knows what other medication you are taking. As mentioned, some patients are recommended to take these medications regularly on a daily basis, while others may take them just as needed several hours before anticipated sexual activity, and still others will take them regularly for a time, then switch to just taking them as needed. The optimal way of taking these drugs has not firmly been established, and different doctors will have different recommendations. Regardless of how they are taken, it has generally been found that the drugs must be taken long-term, as once use is stopped, the problem commonly recurs. When erectile dysfunction is present, it is usually treated first. Then the ejaculation problem is reassessed afterwards. Treatments for ED are discussed in a separate module and may include prescription oral medications such as sildenafil or Viagra, vardenafil, Levitra, or tadalafil, Cialis. Injections, vacuum devices, or surgery are also options. As hinted at earlier, there is much research going on in this field. Researchers are trying to first better characterize and define what normal ejaculation function is in the population, to reach consensus on the definitions of PE, and to develop standardized ways of researching it. Further insights into the cause of PE are being looked into at a genetic and molecular level. Clinicians are refining how to best use the currently available drugs, and research is active in developing new drugs which are even more effective. In summary, premature ejaculation is a common sexual disorder in men. It has a biological and not necessarily a psychological cause in many men. Effective treatments are already available, and even more effective treatment may be on the horizon with active ongoing research into the condition. This slide lists some of the many resources available where you can find more information about premature ejaculation. These references were also used to assist in the preparation of this module. All of these are available through your local medical library or the internet if you are interested in more detailed reading on this subject. We sincerely hope that this module has furthered your understanding of premature ejaculation. We wish you the best for the future, and thank you once again for viewing this educational program. Situation. This program is strictly informational in nature, and no attempt is made to provide opinion or recommendation. Please feel free to view this presentation as many times as necessary. You may also use the player on your left to repeat slides or to skip through them in any order you wish. Premature ejaculation, or PE, is a common sexual disorder, affecting as many as 1/3 of men to some degree. It is now understood that often PE does not have a psychological cause, rather Welcome to this educational program. This module provides a general introduction to premature ejaculation, or PE. This information is taken from a recent review of the medical literature and attempts to be as comprehensive as possible. However, it may not necessarily reflect the experience of your healthcare provider or the specifics of a biologic one. Most importantly, premature ejaculation can be successfully treated. All of this will be discussed in detail through the rest of this presentation. Before going further, we must emphasize a few important points. Firstly, PE is an evolving field of study, and much is yet to be learned about how common it is, what causes it, and how best to treat it. Furthermore, current treatments have been developed through clinical practice and research by experts in the field and have employed medications that were developed for other health conditions. As such, the treatments described in this presentation are not necessarily approved for use in premature ejaculation by the U.S. Food and Drug Administration, Health Canada, or other regulatory bodies. Their use is based on clinical experience, research data, and consensus among expert clinicians in the field. As with any condition, treatments for PE should be individualized with your physician, and potential benefits must outweigh the potential risks. There are many different ways to define premature ejaculation. The American Urological Association defines it as ejaculation that occurs sooner than desired, either before or shortly after penetration, causing distress to either one or both partners. One of the challenges facing doctors treating this condition is that there has previously been very little agreement as to how to define it. The American Urological Association definition just quoted is based on medical history alone. In other words, the